to part 2. Hi all, this is part 2 of supplements and nutrition. I'm Kaleem Joy, licensed midwife, certified pediatric massage therapist, and certified professional midwife. And hopefully those of you who would like to still keep listening, join me again. Sorry about that, but Instagram shuts us off at an hour. So keep coming on and I'll keep waving back at you. All right, let's see here. So, does the refrigerated versus shelf stable make a difference with the probiotics? Yes, it does. I like probiotics that have been in the fridge because usually they are definitely more stable than on a shelf. All right, let's continue on as people choose to come back on if they want to. Hopefully they will. We'll be finishing up here soon. Okay, homeopathics. Here's a homeopathic for those that might be going through doing VBAC or doing a VBAC. You want to add what's called Staph aureus to your homeopathics starting at 38 weeks, taking it twice a day. It really helps to just eliminate some of the things from the section. And I've used that and I find it very, very helpful. Also Semisafuga and aconite. All right, let's go to the last on my list is the ripening that we would use if we needed to. And I love black cohosh tincture. Black cohosh tincture, I usually recommend if somebody normally goes overdue or there's a reason that we've got to kind of get the body moving along because of health or something that's going on in those last few weeks. They buy a tincture bottle, which is an alcohol of black cohosh, and they take a dropper full 4 times a day to ripen, 6 times a day if we're really trying to move it along. And if we're really trying to push labor to start or maybe get the labor to move along, we might use some black cohosh every 30 minutes. That's one I would highly suggest that you talk to your midwives about if you can. Do remember if you go down these supplement lists and you want to talk to your healthcare provider about it, if it is a physician, they may understand some of these things on here. Some of the others they may not have a lot of education and use with. As far as midwives, that is interdependent on whether they're in a hospital setting, a birth center, or at home, and the individual midwifery practice. Not every midwifery practice uses a lot of supplements until the problem comes up. I have found it's most helpful if I can use things as a preventative. All right, let me see if I can get your questions answered now. Could you please show the email again? Yes, I can. Let's see, where'd you go? I think this one. Is it the backwards one? Yep. Hopefully. Still looks a little funny. Anyway, it's Kaleem, KALEEMJOY, midwife @gmail.com. Okay? And most of you on this side know it. But you're not used to this one. It's the midwife one. All right. And you're welcome to message me, but it is helpful if I can get your email. I do a little bit better on emails. I'm still learning social media communication. Let's see, what else? Tablet or capsule for blue-green algae. It's kind of a preference thing. Sometimes I get the capsules because I like taking capsules better than the tablets. When I get the tablets, I actually chew them a little bit in order to swallow them down easier. But either one is going to be fine because your stomach acid is going to be able to kind of chew those up anyway. All right, let's see. Oh, lovely, 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 lovely. All right. Now, have you got more questions for me since we've got a few extra minutes? Otherwise, I'm going to start kind of closing up with you. I do want to remind those of you that might have joined me late, if you will, send me an email at kaleemjoymidwife@gmail.com if you want a copy of the list of the supplements that I talked about tonight, or at least most of them, and their quantities and how often to take them and sort of what they're good for. I'm happy to send them to you. And, feel free to share the lives with your other people in your groups or families or friends, because this is really meant to be the best education that I can get out there from everything that I've learned going through the various years of midwifery. Can you say that email one more time? Yes, I can. It is my name, Kaleem Joy, KALEEMJOY, midwife @gmail.com. Okay, let's see. Had a couple of questions that came in. Let's see where you are. Is dandelion safe for everyone? Sure, you already mentioned it, but thank you. Okay, dandelion. So, unless you're allergic, that you've got problems with something that would be in that type of category, dandelion, unless you have kidney problems, you have liver problems, and I don't mean related to pregnancy. I mean coming into pregnancy, that you have liver disease or kidney disease, you may want to evaluate whether that would be okay. But in general, dandelion is going to be okay for every pregnancy. And how much you take is going to be dependent on whether you're taking it just as a nutritional supplement, whether you're taking it to help solve an issue. I know that I've had women, they'll call us and they'll say, oh, I feel so swollen right now. And I'll say, okay, do you have any headaches, any blurred vision? We want to make sure it's nothing that is more than it should be. And we'll say, take 2 or 3 extra dandelion, eat a bowl of strawberries, eat a cucumber, and let's see if you can pee it off. And normally they do. But if they don't, then I love this phrase, if the problem was going to be there, it's still going to be there. So the dandelion isn't going to solve that problem if there's a problem that's bigger than what the dandelion can do. And remember that we are looking for that prevention, right? It's the foods, it's the fluids, it's taking the dandelion, but I think, I can't really think of a situation where the dandelion would be a problem, let's put it that way, except for chronic liver issues, which in that respect, probably you're not going to be on my lives because you have a lot of medical interventions going on for you, especially if it's a pregnancy. Do you have these lives saved on YouTube or anywhere else? They are saved on Facebook, Natural Childbirth 101. They are uploaded, as many as I can get uploaded, into YouTube, and it is Natural Child, separate word, Birth 101, and you're welcome to go there and share those with others. I'm breastfeeding and pregnant. Congratulations. It's a great thing to do. Make sure that you're taking enough extra iron because usually that's part of what gets pulled out of you during pregnancy and nursing. So when you're doing both, often your iron levels can be low, so make sure you're taking some extra. If your diet happens to be vegan or vegetarian, make sure that you're also adding in that extra B12 to make sure you're getting that good blood volume. But breastfeeding and being pregnant is fine. Now, if you start having contractions or preterm labor, well, then the breastfeeding has to go because there's enough hormones going on that the pregnancy might be in jeopardy. But ordinarily, the body knows to love both babies. Your milk supply does change, usually around 24 weeks, sometimes sooner. And sometimes those nursing babies don't always like the change because the milk changes, it gets more colostrum tasting, and sometimes they will wean. Sometimes they don't. Sometimes they hang in there until the new baby's there, and we always say that the new baby brings all the sweet milk back, and you can tandem nurse if you choose to. Do you have anything to say about that? And I did. But if there's some specifics to that, then, let me know. Sometimes your nipples get sore and you can get tired of nursing. If you are nursing a very young baby that maybe is under a year or isn't taking solids real well, often you end up having to supplement those babies because the new baby in your tummy is sort of telling your body, please don't give all of the nutrients to my sibling on the outside. But if it's a baby that's, up in the middle of a second year, usually things will go well because the baby's eating solids also and getting fluids from other sources. She said there on Facebook under Natural Childbirth. Oh, yep, got it. All right, let's see. What else? Other questions. Morning sickness recommendations. So I think I did do one a few weeks back on morning sickness, so you might look at that. Basically, as I said, it's about using either Sea-Bands, making sure that you never get hungry. Because once you're hungry, it's almost too late. You have to think of your baby as a little hummingbird that goes in there that wants to get those nutrients, and you have to eat little things that are varied, and you have to keep a little bit of fluid and just constantly nibbling and drinking. And additional to that, I want you to know that I'm going to go look and see if I did a morning sickness one actually, because it may have been that I taped it for the online series. That maybe I didn't do a live on it yet. And being able to have a wide variety of foods, you nibble a little bit, and if somebody can just prepare you some of those things ahead of time, put a little plate in the fridge, put a couple of little baggies in the fridge of foods that you just go, you nibble, you eat, you don't think about it, because if you think about food, you're going to get sick again. So people asking you, what do you want? Too late, no good. Just bring you something, tiny little pieces of things, and put some things in the bathroom at night. Put a couple ounces of whether that's juice, a vitamin water, coconut water, something like that in the bathroom, and some little thing that's really easy to just kind of nibble and swallow. And drink it, nibble and swallow, go back to bed. And each time you get up, do the same thing, and before you get up in the morning, about 15 minutes before, have some fluids, have a little nibble, and then try and get up. And if need be, then you move to having to make sure that you have either the Sea-Bands, which is the acupressure points, being able to have the B6, 25 milligrams up to 200 milligrams a day, so you can take 25 milligrams 8 times a day. The Unisom. If you do use Unisom, turn the package over, make sure it says doxylamine, D-O-X, doxylamine, because Unisom comes in many different forms, from gel caps to chews to liquids and all of this. Well, the drug in it is not always the same. So you need the doxylamine, D-O-X, and take a B6 with it. So those have been the best things that we've found that help, as well as just, like I said, making sure you keep hydrated to keep the hormones from concentrating, and take that methylfolate if you can. If you can get a prenatal down, great. Not always can you, all right? But I'll look and see if I did do maybe I didn't do a morning sickness one. I thought I did. Yeah, the sore nipples when you're nursing and you're pregnant can be really challenging. And eventually sometimes you just feel like, well, I think this baby in my tummy is telling me that I need to wean my other baby. Yeah. Okay, let's see. She's a year old, but I think I have to supplement for her because my milk supply is going lower. Yes, and it usually does, and they get a little bit frustrated. So it's helpful to have a cup of yummy milk, which I use either almond milk or cashew milk, or some type of a substitute milk. You can use cow's milk too, but whatever you want to use, and add a little bit of molasses and sometimes even a little bit of banana into it. And a lot of times they really enjoy that. I call it a yummy milk, and they do pretty good with it. But at over a year, they're starting to eat more food, so they do pretty good. All right, I think I'm going to close down for tonight, and it sounds like I need to have another Ask Your Midwife night. You all come with such great questions, and it's so fun to interact with all of you. It looks like I've got just a couple more. Let me make sure I get the Facebook ones. Chlorophyll is great. By the way, it's very good for building your blood. It's very good for keeping yeast away. It's good for your bowels. So chlorophyll is totally fine Chloroxygen happens to be one brand that you can use, but whatever it is that you like. Anything to take during the flu. I was told to take echinacea for cold. Oh, speaking of which, I did forget one. You can take echinacea, colloidal silver, elderberry, cranberry. All of those are good for the cold and flu season. The more, if you can make your own elderberry syrup, that's really more cost effective, and it's a great way to do it. You can order the elderberry, you get local honey, and you just have to make it up in a pot. It's great if you've got young kids, as long as you don't have anybody under 2 taking that because of the honey in it, so you have to use something different. But yes, you can use those. I wanted to tell you our natural recipe, should you come up group beta strep positive, what we recommend to families, because we do not use antibiotics to solve that. Some midwives do. We don't, for all the reasons I mentioned earlier. So what we have families take is echinacea and golden seal, which we do not recommend golden seal under 37 weeks. There supposedly is some risk that it may cause contractions. Haven't seen it yet, but I have to tell you that we just don't use it under there. I've been told that honey needs to wait till age 2. Maybe there's new research that's age 1 now, but I think it's age 2. And elderberry is great. Maple syrup should be fine with a baby who's a year old. So what we use for group beta strep is we have them take a capsule of echinacea, golden seal, cranberry, and probiotic 4 times a day as soon as we find out if they have a positive culture, which is usually around 36 weeks. So they started at 36 weeks. They also start a rinse. Yes, honey is okay during pregnancy. They also start a rinse, which you can get like a medicine syringe, like that you would give medicine to a child. And you can fill a little container with half-strength hydrogen peroxide and water and draw it up, put it up in your vagina, squirt it up in there in the morning, then go take your shower, and then at night before you go to bed. And we find that that has the best way that we can think of helping to make sure that a person who has colonized positive for group beta strep has the best chance of keeping that colonization low. Now, having said that, we also, you only do the rinse until you're in labor or your water releases. Don't do the rinse after your water releases. Now, having said that about remembering that we do births at home, so we do not have the exposure with our families to the hospital germs. We don't check them until they're well close to birthing or there's a reason to check them. So we don't do vaginal checks frequently in order to feed off, to a physician in a hospital setting, where it would be like, I need to call the physician, tell them how far you are, so I need to check you again, and you get checked every 2 to 4 hours. So we don't check anybody. So the risk factors of increasing group beta strep infection are vastly reduced in how we practice at home. So I have to make that disclaimer, as well as saying this is how we would handle it, and we have the families continue to take them after birth for the next 2 to 4 weeks to just make sure that their baby, their milk supply is really boosted in good supportive immune boosts, all right? And so hopefully that helps for those of you that wanted to know an alternative to antibiotics if you're group beta strep positive. And if you take the Femdophilus and you get those good probiotics going in ahead of time, hopefully you won't come up positive. It seems to be helping, that particular one, all right? All right, let's see. I think we're good to go, and I got everybody's questions answered. Yes, yes, yes. Okay, so I want to say to you, thank you so much for joining me tonight. I know this was a lot of information, but often, there's not going to be anybody else to give it to you, because unless your midwives give it to you, most if they're delivering in hospital settings, they don't get a chance to learn about all these supplements. Thanks for all the little hearts and the little loves. I appreciate that. And while this is on the live on Instagram, please share it abundantly. Get people to listen to it, but they can go over to the other sources to also see it. So go in, hug your kids, tell them you love them. Tell them they're amazing and that they can do anything they set their mind to. Because I believe in all of you and what you do and who you are. And I am so grateful to be here to share that with you tonight. So have an awesome week. Have so much fun. Look every day and say, what can I be grateful for today? Because there's always something to be grateful for in everything that you do. All right, take care. Have a great week. Thanks for joining me, and I'll see you next week. Bye for now.